Addiction medicine is very important these days. There is an epidemic across this country, and in fact in a lot of parts of the world, but certainly in the United States with addiction, especially opiate addiction. It's a very serious problem. A lot of lives are being ruined. People whose lives have barely started are being derailed completely by addiction. So we provide treatment here for addiction, medical treatment, but we also want patients to do therapy and to see counselors and do a lot of the other modalities that are involved in treating addiction. Addiction is not an easy thing to treat, and there's no easy fix, but medication can help, can be a very important help in terms of helping patients get past their addiction, start to feel normal again, and so that they can pick up the pieces of their lives and then rebuild their lives into something meaningful and something that they'll be very happy with. With addiction, it's very important to keep in mind that it's actually a disease of the brain. It is not a failing of one's character or some moral failing. There have been many patients who are addicts who've been raised in very strong and very good families, but they nevertheless have an addiction problem. And it comes back to how the brain works, how the addiction has affected the brain, and we have to approach it that way. So medication in this situation can be very important. Just like when you treat someone for diabetes or high blood pressure or heart disease or whatever, they're going to be on medication. Now, do they have to be on medication forever? Not necessarily, but they certainly need to be on medication to help them pick up the pieces of their lives and try to put this addiction behind them so that they can move on with their life and not be constantly brought down by this addiction.